Good morning to you guys. Welcome to our show this fine morning. I will be your host, Nelia Smaina. And as of today, we have our guest, who is apparently the Deputy CEO of the Afya 101 Health Checkup, but I will let him introduce himself.
Thank you so much. Good morning, guys. My name is Elvis Nganga, the Deputy CEO at Afya 101, and it's a delight to be here.
We are glad to have you.
Thank you, thank you.
All right, so we have a lot of questions about the organization.
All right.
It's all about the youth, right?
Yes.
So what is Afya generally all about?
Afya 101, in a nutshell rather, it's a digital platform that we have developed. It's a tech product where we do, or rather we encourage health checkups, especially among the youth. Not just the youth, but especially among the youth. Reason for that target is, we realize we can do something about the rate of chronic disease amongst the youth. So that is where we are majoring on that, but we'll get into that a bit later on. But yeah, it's basically a health digital platform that helps you to monitor your health, vital status, and as well keep your health records on the reach of your phone.
All right,
yes,
so
yes.
For us youths to reach you, what was the inspiration of starting such an organization?
All right, personal story. We have had friends who have succumbed to stroke, to collapsing, and after further investigations, we realized actually they had underlying chronic diseases. So we felt, looking at the statistics of, the chronic diseases amongst the youths, it's at like 22%, close to 30% right now. And if we don't do something about it, this number could potentially grow to 50%. And what that means is 1 in every 2 youths or other young people will have a chronic disease, whether it is hypertension, whether it is diabetes, name it. So we decided we can do something about the narrative. We may not be able to solve the situation completely, but we are hopeful that we can reduce the margin of the growing numbers.
All right.
Yes.
Okay, so youths, most of the youths don't like going for checkups.
Yes.
Very less percentage.
Yes, yes.
How is the turn up of the youths coming to have the regular checkups at your company?
All right, it's a good thing you actually identify that most youths don't do checkups.
True.
And when you look at the statistics, less than 1% actually conduct checkups. So when we were starting off, of course, we were ish about the situation, but as of now, we are really encouraged. We've had a couple of events so far, and the turn up was really encouraging. Yeah, the young people are actually embracing the whole concept, and we're really happy about the turnout so far. Yes.
Okay. So the youths, I had a friend who was asking me, your organization,
yes,
how many stations are there? Is it stationary or mobile? Do you go from a place to place conducting these checkups?
Yes.
Or how do you do it?
So we are approaching it on both fronts. We have stationary stations. We have like 3 chemists so far who have been onboarded as our agents. But besides that, we also do mobile. We do events. We go from one event to another. We conduct the checkups there. We do sign-ups at the same place. And also high school tours, campus tours. So we are approaching it on both fronts. We're doing stationary and also we're doing mobile. Yes,
right.
yes.
I'm glad that's... Okay. Umefika Rongai.
Actually, that is where we are at. That's where we started because they say charity begins at home, right? So we started in Rongai. We have 3 chemists so far in Rongai. And we have our station as well. That is Mungano building, 2nd floor, room B9. That is where we do our own checkups. But besides that, we have the chemists. And when you go to that platform, you will have, there's a provision for a map. You can actually search the nearest agent near you, and you will see the number of chemists that have actually been onboarded as our agents. Yes.
Right.
Yes.
Okay. Our partnerships. Your organization will become a big company in the next...
Yes.
In the next years.
Yes,
hopefully.
Yes.
So, how many partnerships do you guys have? Either public sectors or private?
Currently, when it comes to partnerships, we're still having conversations going on. But what we're doing, we're working with hospitals, pharmacies, and chemists to just ensure the narrative is spreading. So we are open to like working with people, not necessarily defined partnerships, but we are working with people, the health sector as well and the tech sector as well.
Right.
Yes, yes.
Okay. So apparently,
Yes.
earlier on, I was going through your page.
Yes.
And I saw that you guys played the Loopers League game.
Yes.
Why that game? What is that game?
Well, we needed something that the youth can identify with. We also needed something that is our own, because even the Afya 101 itself, it's a platform by the youth and for the youth. So when we looked at just conducting checkups, it may not necessarily be very exciting. You know, like you said, most people don't love the hospital conversations, yeah? So we decided, okay, how about we have a game that we can work with? And we looked at the many games people have, you know, already established and all that, and decided, you know what? There are games we used to play kitambo tukiwa wadogo. We can actually use that, give it a structure, and make it something big. So that's what the Loopers League is about. It's a very simple game, but now we have given it structure, and we build teams, we develop these tournaments that happen every month, and then we compete, and from those gatherings we can have these conversations on health checkups and also conduct the checkups as well.
What makes that game or your organization stand out to the youths out there, to the public? What makes it stand out?
Like I said, it is by the youth, for the youth. That is where we are majorly targeting the youth. We want people to feel they can actually be in charge. For instance, when it comes to your health records, most times when you go to a hospital, you don't get the records after that. When you go to a different hospital, you'll have to redo it again. But now we're trying to tell people, you know what? You can actually conduct a checkup and be in charge of that health data right on your mobile phone. Most people are on mobile phones right now. Like our generation is the digital generation. So the fact that you actually have a gadget, you can access these things, not just use it for other things, but you can actually use it to monitor how your body is doing, right? We are looking at whatever people can relate with, and that is what we're giving them, but now making it, or rather using it for a better use. Yes.
Oh, I get you.
Yeah.
I get you. How long has it been active? The organization since? I went to your research page. I signed up myself.
Yes, thank you for that.
Go sign up.
Thank you for that.
Yeah. So how long has it been active? Years, months?
It's still in the month stage. We started early this year, just having the conversation, testing the platforms, you know, just trying to have people on board. But now for actively engaging people, from March, we've been having active interactions with people.
All right.
Yes, yes.
Okay, so I was asked this question. Sikitambo sana. But why only focus on the youths? Always you focus like on the less children when you're coaching it, or the elderly?
Okay, so we're looking at the fact that we're saying prevention is better than cure. For most youths, they are not yet there. We have like the number I mentioned earlier, the 30%, you know. But this number, because it has potential to grow, how about we work with these people who are not yet already there and help them, or rather work with them before they get to that last stage. So having these conversations with them, we paint the picture of why should you do a checkup right now? Why should you be in charge? Why should you monitor how your body is doing right now? For people who are advanced in years, most of them are already there. You know, most of them are already in that situation where they are managing the situation of the chronic disease. But now for the youths, most of them are not yet there. So we chose to, let's work with these people. Let's help them manage rather than spend resources later in future trying to heal or rather cure the situation. And most times we feel like we have a lot of time, the youths especially, because we feel, I'm still young, I'm like 30, 20, in there about, I can still have like 40, 50 plus years to take care of myself. But actually we don't know that you're going to have the 70 years plus, you know. So how about you be in charge right now? Don't wait till you're there to try and run to the hospitals. Do something about it right now. We're also working with younger people because they're looking into, like I said, working with this, preventing before they get there. So when you're doing the tours, you're also doing the high school and the primary school as well. Yes. And also in our platform, we have the provision where if a parent is already there, they can actually onboard their kid on their own account. So they can as well monitor the vital status of their children from an early stage. Yes.
As I know, the youths are usually quite arrogant about these things. So what percentage can you say umefikia watu huko nje, especially the youths, umefikia, how many umefikia percentage generally?
Well, as of now, in Kajiado, in Rongai, where we're at, I can say we are at 20-25% of the population in Rongai so far. Yes.
Youths only?
Youths only.
Oh, wow.
Yeah, and also a small percentage of people who are elderly, but yeah, those are the numbers so far.
All right, I'm glad. So it's mainly located in Rongai?
Yes, yes, yes. We are currently in Rongai. That is where we are at. That is where our office is at. That is why I said we are starting with chemists around Rongai, because that is where we are.
All right.
Yes.
So guys, after that, let's have a short commercial break.
Thank you.
Welcome back. Without further ado, we'll continue our conversation. So, Elvis.
Yes.
What do you plan? What's the achievement in the next year about for the organization?
Okay, so we are hoping that the narrative continues. That is our health checkup culture narrative, yeah? So we're hoping that in the next year or in the next couple of years or whichever period of time in the future, we'll be able to achieve this conversation. We want to get to a place where the youth can comfortably talk about health checkup and they can, readily embrace the whole concept, because I mean, if we need to see this change, we have to do something about it. One thing about the chronic diseases is that the patient has a bigger role to play, So you're hoping that at the end of the day, this conversation goes on, and if someone is already there, they should know that they are not alone in this. We are working with you. We are, availing the necessary resources that can actually help you manage your current situation. So the future looks bright, I can say, from the experience so far.
All right.
Yes.
Every organization, I presume, there are challenges faced.
Well, yeah.
I'm pretty sure you face some challenges.
Absolutely. I think one of the major challenges we've experienced is people to really embrace the fact that checkups can be done. Most still feel it's a thing for the rich people. Other people feel what I don't know would kill me, so I'd rather not find out right now. So I think the major challenge has been trying to paint the picture for people, to show them that actually it is affordable, it is accessible, and you need it. You actually need it. So I think that I'd say is the major challenge. Another challenge I'd say is, you see, when you're talking about Afya 101 platform, we are trying to avail the platform, or the avenue for people to conduct checkups at a very affordable rate. But then some people feel whatever we are charging is quite low. So some people are feeling like we should think, be more business oriented. But for us, we're really hopeful to change the narrative. It's more of impact than the value we're getting in terms of money. Yes. So those are the two major challenges.
All right. So yes. The section of payment. Can one use cards like a Jubilee card, CIS, NHIF?
For the insurance?
Yeah.
Currently, we are having the conversations to also try look into people who already have insurances. It's not yet finalized, but what we can do, we're doing cash payments at the moment. Yeah, but then later in future, we believe we're going to be able to come to an agreement and we'll have the insurance companies on board. Yes,
right.
Yes.
Guys, as you've heard, prevention is better than cure.
That's
For
right.
the youths out there, go sign up.
Yeah.
And Elvis, please tell us all your social media handles, how people can reach you out there.
Okay. For signing up, be sure to search on your Google. It's a web app. So search afya101.co.ke. You will find us there. It's a very simple platform, very friendly, user-friendly. So just sign up, follow the promptings, create an account. After that, we are on Instagram as afya101.co.ke and on YouTube at Afya 101 Network. So that's how you can find us.
And there you have it.
Yeah.
Go subscribe, comment, share, and sign up.
Yes.
Prevention is better than cure.
Definitely it is.
I have been your host, Nelias Maina. Until next time, see you.